Hair loss, a dramatic epic journey into understanding and treatment. Hair loss, a condition that transcends the superficial, piercing the very identity of those who face it. For many, it begins subtly, a strand on the pillow, a patch that seems thinner in the mirror. For others, it arrives like a storm, sudden and unrelenting. What causes this loss? What is the root of this universal struggle? Let us dive deep into the epic narrative of hair loss and uncover the truths that science has revealed. What causes hair loss? Androgenetic alopecia, male/female pattern baldness, the villain in the story for many. It's insidious and genetic, passed down through generations. Hormonal changes, particularly the heightened sensitivity to dihydrotestosterone, DHT, shorten the hair growth cycle, causing miniaturization of hair follicles. Without intervention, it's permanent, though medications like minoxidil and finasteride offer a glimmer of hope, slowing its progression. Telogen effluvium, this is the body's cry for help. It strikes after acute stress, physical or emotional, or significant events like severe illness, surgery, or childbirth. Nutritional deficiencies, hormonal shifts, and medications act as triggers, causing diffuse shedding. But here, there is hope. Remove the stressor, and the hair, like a phoenix, can rise again. Alopecia areata, an autoimmune twist in the tail. The body turns against itself, attacking its hair follicles. Round, bald patches appear suddenly, often linked to genetic predisposition or stress. Associated with other autoimmune diseases, alopecia areata may resolve, recur, or, in severe cases, lead to permanent loss. Traction alopecia, the story of tension and trauma. Tight hairstyles, chemical relaxers, and constant strain on the hair lead to gradual loss. Recognize it early, loosen the grip, and the hair can recover. But ignored, it becomes a tale of permanent loss. Scarring alopecia, cicatricial alopecia, a permanent and tragic end for many follicles. Chronic inflammation, autoimmune disorders like lupus, or infections destroy the follicular structures, leaving scarred tissue in their place. This is where science fights to slow the irreversible. Anagen effluvium, a battle against external forces, chemotherapy, radiation therapy, or toxic chemicals. The hair is lost rapidly, but with the cessation of the assault, regrowth often follows. Trichotillomania, a psychological struggle, a compulsion to pull hair out. Driven by stress or anxiety, it leaves patchy, self-inflicted damage. Treat the mind, and the hair has a chance to return. Nutritional and metabolic disorders. Hair, like a mirror, reflects internal deficiencies. Protein starvation, thyroid imbalances, or lack of vital nutrients like zinc and iron weaken it. But the cure lies in balance, restoring what's missing. Infections and hair shaft abnormalities, fungal invasions like tinea capitis, bacterial folliculitis, or genetic conditions damage the scalp and hair. Once treated, the scalp heals, and hair often regrows. Drug-induced hair loss, medications that save lives, antidepressants, chemotherapy agents, sometimes take hair as collateral damage. But this loss is often temporary, a chapter that ends once treatment concludes. Hormonal hair loss, postpartum, menopause, PCOS, these are hormonal crossroads. Addressing imbalances can restore the story of growth. How can I know what type? Androgenetic alopecia, pattern thinning, receding hem shape in men, diffuse top thinning in women. Alopecia areata, round, patchy losses that may escalate to complete scalp or body baldness. Telogen effluvium, diffuse shedding after stress or illness. Traction alopecia, loss around the hairline, often from tight hairstyles. Frontal fibrosing alopecia, a receding hairline paired with eyebrow loss. Symptoms like itching, burning, or scaling provide further clues. Diagnostic tools, pull tests, trichoscopy, blood panels, and biopsies confirm the diagnosis. The battle against hair loss. Treatments, pharmacologic warriors, minoxidil, a topical hero applied twice daily. stimulating follicles into growth. Finasteride, a systemic ally for men, blocking DHT's destructive effects. JAK inhibitors, revolutionary treatments like ruxolitinib combat autoimmune alopecia. Non-pharmacologic allies, low-level laser therapy, harnessing light to awaken dormant follicles. Hair transplants, surgically redistributing hair to restore lost density. Innovations of 2024 bring hope. Topical finasteride, efficacy without systemic side effects. PRP therapy, plasma treatments to rejuvenate the scalp. The treatment for alopecia areata begins with precision and determination. This autoimmune adversary, which turns the body's defenses against its own hair follicles, demands a strategic approach. Pharmacologic allies step into the fray. Intralesional corticosteroids, triamcinolone acetonide, 2.5 to 10 mg/ml, is injected directly into the affected areas every 4 to 6 weeks, calming inflammation and halting the attack. Topical corticosteroids. Clobetasol propionate 0.05%, applied twice daily, reinforces the fight from the surface. Topical immunotherapy. Enter difencyprol. DPCP, a deliberate irritant designed to awaken the immune system and distract it from its follicular assault. Oral JAK inhibitors, ruxolitinib and tofacitinib. Cutting-edge therapies strike at the heart of the immune dysregulation, offering a beacon of hope. Non-pharmacologic measures bring resilience. Wigs and hairpieces. For those facing the visible impact, these become shields of confidence. Psychological support. Emotional scars demand attention too. Counseling becomes a vital lifeline. Latest updates, 2024, shine a brighter light. Duruxolitinib. FDA approved, this new oral JAK inhibitor is transforming severe AA treatment. Ritlecitinib. Sustained hair regrowth is no longer a distant dream, with research advancing its promise. Telogen effluvium, TE recovery from the silent thief of hair. This condition sweeps across the scalp in waves, triggered by stress, illness, or hormonal upheavals. Its treatment focuses on restoring balance and growth. Pharmacologic intervention. Topical minoxidil accelerates recovery, pushing dormant follicles back into action. Non-pharmacologic strategies, addressing underlying causes. The root of TE is often external. Removing stressors or correcting medical conditions turns the tide. Nutritional support, essential vitamins and minerals, like iron and zinc, fortify the scalp for regrowth. Latest innovations, 2024, offer new tools. Microneedling. Once a cosmetic tool, now a regenerative ally. Stimulating follicles to awaken through controlled microinjuries. Central centrifugal cicatricial alopecia, CCCA fighting scarring alopecia at its core. This relentless condition, often affecting women of African descent, leads to permanent hair loss if left unchecked. Pharmacologic arsenal. Topical corticosteroids. Clobetasol propionate 0.05%, twice daily. Combats inflammation. Intralesional corticosteroids. Triamcinolone acetonide 10 mg per milliliter, injected monthly, targets deep-seated damage. Oral tetracyclines. Doxycycline 100 mg twice daily reduces inflammation. Hydroxychloroquine 200 mg twice daily, with careful ocular monitoring, slows disease progression. Non-pharmacologic efforts. Avoid traumatic practices. Tight hairstyles and chemical treatments must be abandoned to halt further damage. Latest updates, 2024, prioritize vigilance, recognition of atypical presentations. Early diagnosis becomes paramount to halt this condition before irreversible harm sets in. Frontal fibrosing alopecia, FFA, the receding hairline of mystery. This scarring alopecia stealthily claims the hairline and eyebrows, primarily in postmenopausal women. Pharmacologic interventions. Topical corticosteroids. Clobetasol propionate 0.05% soothes inflammation at the scalp's edge. Intralesional corticosteroids. Triamcinolone acetonide, 5 to 10 mg/ml, injected monthly fights deeper damage. Oral finasteride, 2.5 mg daily, combats hormonal factors in this puzzling condition. Oral hydroxychloroquine, 200 mg twice daily adds an anti-inflammatory edge, requiring vigilant monitoring. Future innovations on the horizon: gene therapy. CRISPR-Cas9 could rewrite the genetic code of hair loss, targeting DHT pathways and follicular cycles. Stem cell therapy, a regenerative revolution. Stem cells promise to awaken dormant follicles or even create new ones. Trials in Japan and beyond show promise. Hair follicle cloning. Imagine creating unlimited follicles in a lab. This dream edges closer to reality, with advances in 3D bioprinting, artificial intelligence and precision medicine. AI-driven diagnostics and tailored treatment plans ensure that each patient's journey is unique and effective. Nanotechnology and microneedling, localized. Precision drug delivery systems revolutionize existing treatments, maximizing results while minimizing side effects. Platelet-derived growth factors and exosome therapy. Imagine a treatment so advanced it speaks the language of your cells. Exosomes, tiny, extracellular vesicles, carry growth factors, cytokines, and genetic material, whispering instructions for regeneration to dormant hair follicles. These non-invasive and well-tolerated therapies are transforming the landscape of hair restoration. The advantages: exosomes enhance communication between cells, promoting not just hair growth, but the revival of vitality at the follicular level. Ongoing research: the quest for synergy is underway. Scientists are combining exosome-based therapies with microneedling and platelet-rich plasma, PRP, to amplify their effects. Creating a powerful trifecta in the battle against hair loss. Oral and topical prostaglandin analogs. Prostaglandin analogs, like bimatoprost, once known for their role in glaucoma treatment, are now stepping onto the stage as unlikely heroes in hair regrowth. The future directions: development is focused on topical formulations targeting scalp follicles with precision. Innovative delivery methods are being refined to ensure maximum penetration, pushing the boundaries of what's possible in targeted hair restoration. Biologics and JAK inhibitors, for those facing autoimmune-related hair loss, such as alopecia areata. The cavalry has arrived in the form of biologics and Janus kinase, JAK, inhibitors. These groundbreaking treatments address the root cause, immune dysregulation, offering hope where there was once despair. New approvals: duroxolutinib, a newly approved oral JAK inhibitor, delivering sustained regrowth for those with severe alopecia areata. Ritlecitinib, a rising star, showing remarkable results in clinical trials, with long-term regrowth now within reach. Future applications: combination therapies with other immunomodulators are on the horizon, promising more comprehensive and tailored approaches to autoimmune hair loss. Hormone modulation. Hormonal imbalances are a formidable adversary in hair loss. Yet, innovation is paving the way for safer, more targeted treatments. The innovations: selective androgen receptor modulators, SARMs designed for localized effects. These modulators minimize systemic side effects while tackling hormonal triggers. Topical anti-androgens. Refinements in these formulations aim to reduce hair follicle sensitivity to dihydrotestosterone, DHT, a key factor in androgenetic alopecia. Digital scalp health platforms step into the future of personalized hair care. With digital health platforms and wearable devices that monitor your scalp's health in real time. The features: apps integrated with scalp cameras track progress and detect changes. AI-powered algorithms analyze scalp conditions and hair density, delivering personalized recommendations tailored to your unique biology. The epic conclusion: hair loss is not just a medical condition, it's a deeply personal journey. With each strand lost, there is a story of struggle, of identity. But this is also a tale of hope. Science marches forward, and the future is bright with innovation and possibility. From genetic rewrites to stem cell miracles, the fight against hair loss is reaching epic new heights. Together, we stand on the brink of a new era in hair restoration.